the field of head and neck cancer, and that includes both HPV positive as well as HPV negative head and neck tumors, as well as nasopharyngeal tumors, are really impressed by the recent immunotherapy data. We now have data with two agents, one being the PD-1 inhibitor pembrolizumab, the other one being the PD-L1 inhibitor durvalumab. Both of these show substantial activity in head and neck tumors, and pembrolizumab also in nasopharyngeal tumors. I think we now have at this point, at least for HPV positive, HPV negative head and neck tumors, sufficient data to get a first assessment of survival. When we analyze all available data, we have about 192 patients now. And if you look at the median overall survival, that is close to 10 months. And please keep in mind, this is a heavily pre-treated population, patients that are third, second, fourth line, usually not a population that does very well. However, the median overall survival at 10 months is quite good. It's certainly on par with what we would see, for example, with doublet chemotherapy in the first line, so a more favorable patient population, as well as even comparing with the best treatment, which would be the extreme regimen. And what is remarkable is that the survival curve actually flattens out, meaning that maybe it's even superior in the long term. So I think there's a lot of excitement in head and neck cancer. We are awaiting data from the phase 3 study of nivolumab, as well as more data with pembrolizumab from the KEYNOTE-55 study. So I think very soon, I think we'll have more mature data, and I think there's a good chance that these agents will find approval in head and neck cancer very soon. So I'm excited about this. Also, I think we have some biomarker data that suggests that maybe a second generation of biomarkers will be important. PD-L1 is helpful, but also problematic. There's a new biomarker using an immune an interferon gamma signature, and that looks quite promising as well. I think we need validation, but I think there's a lot of insight coming forward, and will help us decide and identify those patients that are most likely to benefit from immunotherapy.